Hi, I'm Dr. Rahman. It seems as though vaginal dryness is one of those things that you don't talk about until it's impossible to ignore. Last week, I talked about vaginal lubricants and vaginal moisturizers. And the reason I did that is because that's usually the first thing that's recommended to women when they start to complain about vaginal dryness. But sometimes that's not enough. Sometimes it doesn't work. So what's a woman to do? And I'm here to say that there are other options. But first, let's go undercover. Now let's go all back to the physiology. Why does this happen in the first place? This happens because of decreasing estrogen levels, which is why local estrogen replacement to that area is considered the answer, the gold standard. And you can take estrogen in a lot of different ways: a cream, a pill, a ring. Local estrogen to replace the estrogen that your body is no longer making. But what if you're someone that doesn't want to use estrogen, or for whatever reason is not able to? I like to talk about two other possible options for consideration. Both of these are prescription drugs, which means you will need to get a prescription from your healthcare provider. The first is called Osphena, which is the brand name. Osphena is the generic name. This is what's called a selective estrogen receptive modulator. It's a pill that you take orally every day, and what it does is increases the estrogen levels locally, meaning in the vaginal vulvar area. The other is DHEA, dehydroepiandrosterone. The brand name is Intrarosa. It's a vaginal insert. You place it daily, and once inside your vagina, it's metabolized to estrogen and testosterone. What's important to know that with both of these treatments, whether it's a pill that you take orally or an insert that you place in your vagina, the result is a local increase in the amount of estrogen that the tissue, the vulva and the vagina sees. And as a result, it's considered treatment for vaginal dryness. What you should know if you are a breast cancer survivor: there comes a point after surviving the diagnosis and the treatment of breast cancer, it really becomes, what is my quality of life going to be after this diagnosis? And sometimes vaginal dryness can be problematic because of the possibility that these two prescription drugs might increase the estrogen exposure beyond the vulvar vaginal area. It's recommended that this not be your first choice, and that it only become a consideration after careful consultation with your oncologist. Now, and if you're someone that says, not something I want to consider, the vaginal moisturizers, the lubricants don't seem to be working, next week I will talk about a more holistic approach. So tune in, Menopause No Filter, as we talk about holistic options that may help you in terms of the vaginal dryness. Until then, take care.